This is the continuation of a musculoskeletal system. In this video, we will cover bone types. Bone types can be classified according to the shape and the size of the bone. The shapes of bone reflect their functions. It is useful when describing specific bone to begin by stating the type of bone in relation to its shape. For example, the scapula is a large, flat, triangular bone. In terms of bone shapes, there are 5 main types of bone. They are long bones, short bones, flat bones, irregular bones, sesamoid bones. Short, irregular, flat and sesamoid bones have no shaft or extremities and are diverse in shape and size. For example, short bones, carpals, irregular bones, vertebrae and some skull bones. Examples for flat bones, sternum, ribs and most skull bones. Examples for sesamoid bones, patella or kneecap. Now we will see each type in detail. First one is long bones. Long bones have a long bone shaft with expanded ends and are much longer than they are wide and are named for their elongated shape instead of their actual size. For example, the 3 bones of each finger are long bones even though they are relatively small. All bones of the limbs are long bones except for patella, that is kneecap, and the bones of the wrist and the ankles. Long bones are located in the arms, legs, palms, soles, fingers and toes. Long bones are often curved to assist with strength. They are longer and wider than other bones and consist of a shaft and a variable number of extremities, that is endings. The femur, tibia, fibula, humerus, ulna and radius are examples of long bones. These consist of a shaft and 2 extremities. As the name suggests, the length is much greater than the width. Long bones have a diaphysis or shaft and 2 epiphyses or extremities. The diaphysis is composed of a combat bone with a central medullary canal containing fat yellow bone marrow. The epiphysis consists of an outer covering of a combat bone with a cancellous bone inside. The diaphysis and epiphysis are separated by epiphyseal cartilages which ossify when growth is complete. Thickening of a bone occurs by the deposition of new bone tissue under the periosteum. Long bones are almost completely covered by a vascular membrane, the periosteum. The outer layer is fibrous and the inner layer is osteogenic, containing osteoblast, that is bone forming cells, and osteoclast, that is bone destroying cells, which are involved in maintenance and remodeling of bones. It gives attachment to muscles and tendons and protects bones from injury. Hyaline cartilage replaces periosteum on the articular surfaces of bones forming synovial joints. A medullary cavity is present in long bones as this region is not required to take any load or other stress, which makes the bone lighter without any loss of strength. The space contains bone marrow. Now we will see short bones. Short bones can be described small and often cube shaped and approximately the same size, length and width. Their primary function is to provide support and stability with little movement. Examples of short bones are carpals, seen in wrist, and tarsals, which is found in foot or ankle bones. These bones consist of only a thin layer of combat hard bone with a cancellous bone on the inside with relatively large amounts of bone marrow. Now we will cover flat bones. Flat bones resemble plates with broad surfaces. It may be thin and slightly curved. Flat bones are very strong. Flat plates of bone whose key function is to provide protection to the body's vital organs as well as being a base for muscular attachment. A prime example of a flat bone is the scapula, that is called shoulder blade, the sternum, that is breastbone, cranium, that is skull, os coxae, that is hip bone, pelvis and ribs are also classed as flat bones. The anterior and posterior surfaces are formed of combat bone with the intention of providing strength for protection. The center consists of cancellous, that is spongy bone with various amounts of bone marrow. The greatest number of red blood cells are formed in flat bones in adults. The flat bones are located where extensive protection of underlying structures is needed, for example, sternum or skull. Next is irregular bones. Irregular bones have different and complex shapes and are often connected to other bones. These bones do not fall into any other category because of their non-uniform shape. They include many facial bones and those that make up the vertebrae in the spine, the pelvis and mandible, that is lower jaw. They consist chiefly of cancellous bone with a thin outer layer of combat bone. Irregular bones have unique shapes related to their function. Generally, irregular bone structure is similar to that of flat bones. Bone is composed of cells, protein matrix, and mineral deposits. Next is sesamoid bone. These types of bones are mostly short or irregular bones, small, flat bones resembling sesame seeds that are most often located near joints within tendons of the hands, knees, and feet. Sesamoid bones are usually present in a tendon where it passes over a joint. This provides protection for the tendon. The patella or kneecap is the most obvious example of this and sits within the patella or quadriceps tendon. Other types of sesamoid bones are the pisiform, smallest of the carpals, and the two small bones at the base of the first metatarsal. These types of bone may form in up to 26 locations in the body. Each individual has different numbers of sesamoid bones. Some help to control the directions in which tendons pull, and some have unknown function. There is one more type, that is suturar bone, also known as Wormian bones. These are the small, flat, and irregular bones between the flat bones of the skull. They range in size from as large as a quarter to as small as a grain of sand. Bones are constructed of cortical or cancellous bone tissue. Cortical bone exists in areas where support is needed, and cancellous bone is found where hematopoiesis and bone formation occur. For example, long bones are designed for weight bearing and movement and tend to be composed primarily of cortical bone, whereas flat bones, which are important sites of hematopoiesis and frequently protect vital organs, are made of cancellous bone layered between combat bones. Short bones consist of cancellous bone covered by a layer of cortical bone. Short, irregular, flat, and sesamoid bones have a relatively thin outer layer of a combat bone with cancellous bone inside containing red bone marrow. They are enclosed by periosteum except the inner layer of the cranial bones where it is replaced by dura mater.